Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is Dr. Manan Shah, the co-founder and chief medical officer at Wyndly. How are you today?
Hey guys, thanks so much for having me, Jared. I'm super excited to be on the podcast.
This is like a first, been up since 2 a.m. You're getting, it's about to get real loopy on this episode. No, I'm just kidding.
Yeah.
Really, really excited to have you here today. We keep these short and sweet. So why don't we start by you giving us a little bit about your background, and then we'll talk a little bit about Wyndly and allergies.
Yeah. So I'm a board certified ENT with a focus on ENT and allergy. I've been really involved in telehealth since my training, sitting in the Academy of ENT's telehealth committee, and really just excited about how we can bring more access to our specialty.
And you're involved with, you're a very busy person. How do you manage it all? Because I mean, when people go and check out your profile, right, when they're listening to this, you're involved with a little bit of everything. I know this is like your baby, right, that you're building. And the other stuff too is not like, it's not like crazy stuff that takes all your time, right? But you are
Yeah.
involved with some good stuff. But I also think it's really cool the different organizations you're involved with. It all goes back in a way to Wyndly, right? Like those
Exactly.
relationships and those opportunities are good for the Wyndly business. So it's not like you're I have I race cars on the weekend,
Yeah.
and
Yeah.
I have, it's so. Talk us through your time management. Like how are you managing all this?
Yeah. So honestly, in some ways, it feels like Wyndly. And just for everyone on the podcast, just to give a little bit of background, Wyndly is a telehealth allergy practice. And what it allows you to do is get tested for your allergies from home and meet with a physician online via synchronous video and get what's called immunotherapy, which is a method that we use to prescribe you a clinically proven treatment. It exposes your body to just a small bit of what you're allergic to, and over time you become desensitized. So essentially, instead of having to take, antihistamines and Zyrtec and Claritin for your allergies for the rest of your life, we make it so that you can stop taking pills and sprays and just live better. And so I would say Wyndly is sort of the culmination of everything I've been working on, right? So I'm an ENT, an allergist. I had a private practice. We were doing this in our physical office. I also am super involved with the Academy of ENT, which is sort of our national organization. In the Academy of ENT, I sat on the medical device committee. We were trying to figure out how can we, spur innovation within our field. I also sit on the telehealth committee. And again, we were trying to figure out how can we bring telehealth into a specialty that's, traditionally been in person. And so I think kind of putting all these things together, doing some research in that area, working with other colleagues, we sort of started to realize that, with an ENT practice, there are certain things you got to come in, right? If you have an ear infection, someone has to come in and take a look at your ears. But there are other things like allergies, which are very history based, which are great for telehealth. And I think what we're starting to see is that in the future, patients are going to want sort of this hybrid care. They're going to want to go in and see their doctor sometimes, but they also want the access and ease of being able to do like a Zoom meeting with their doctor. And Wyndly felt like this way of marrying my two interests of clinical ENT, but also trying to bring the healthcare field forward.
I hear a lot that so this is the right time, right? And correct me if I'm wrong, but I do hear a lot that allergies are on the rise. Why is that?
Yeah. So there's a number of different reasons. I'm going to go through a couple of them. The biggest reason, unfortunately, is that basically trees, grasses, weeds, plants, just like humans breathe in oxygen for energy, plants use carbon dioxide. And for reasons that we don't have to get into, the climate is changing and there's more carbon dioxide in our environment. And so what that's leading to is that the pollen seasons for things like ragweed or tree pollen are getting longer. And carbon dioxide is actually a stimulus for plants to release their pollen. The other thing that's happening that's really interesting is we have more carbon dioxide in our environment and in our atmosphere. The weather patterns are just a little bit more irregular. And so that leads to more wind and things that distribute things like pollen more. Unfortunately, the thing that's sort of working at the same time or dovetailing with this is that we have a world that has more air pollution and more basically small particles that are in the atmosphere that are irritating people's lungs. So what we're seeing is that reactive airway disease, things like asthma, allergies, they're all starting to increase across populations. And then lastly, there's this thing called the hygiene hypothesis, which we're still thinking about. And look, this isn't set in stone, But this is this idea that as we live in a way that's a little bit less natural, we have less time as a child for our bodies and our immune systems to determine what is what's normal and what's not. And as a result, many people are starting to have their immune system attack things that are not scary, right? So allergies are when your immune system is literally responding to something like tree pollen as if it's a parasite or invader, and it's trying to wash it out and sneeze it out. But you and I know that it sort of makes no sense that human beings would be allergic to trees, right? Like we literally have lived around trees for all of our life, as long as humans have been around. And yet your immune system makes this mistake. It starts to think of the tree or the ragweed or even a cat or dog as this foreign invader, and it responds to it with inflammation. And what we're trying to do here at Wyndly is retrain your immune system. We're trying to give you this opportunity to go back to when you were young and say, wait, 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 wait. Instead of overreacting to cats or dogs, maybe we should just show your immune system that this is part of nature. Um, and kind of like our motivation behind that is I'm over here in Denver. Denver's a massively outdoor city. Everyone is spending every weekend in the mountains, skiing, hiking. And, this idea that you could not be doing that because you have allergies was really frustrating to me. And then I'm an allergy sufferer myself.
So allergy care is so important, right? But it really does need to be reinvented. When you look at, there's like less than 5,000 allergists, and something, like 70 plus million people that have allergies. Talk us through why. I mean, you already gave us some good information about why, just what you're saying, right? But why does allergy care need to be reinvented? And obviously, that's part of why you're building Wyndly.
Yeah. So as I was talking about, because of certain factors like climate change and air pollution and hygiene, allergies are exploding. So the CDC says there's about 80 million people who are suffering from environmental allergens. That means 1 in 4 Americans. So you, me, every one of us knows someone who hates spring, who hates the fall, who feels like they can never go outside because they're just living on Claritin or Zyrtec. But because of reasons that are complicated with our healthcare system and the way our residency program is set up, and also because of incentives, there's only 4,000 allergists, meaning that the biggest problem is most people just don't have access to that kind of care. And most people just don't even realize it, right? We've been told by Claritin and Zyrtec that you should just pop a pill for the rest of your life. Most people don't even realize there's actually a cure or a way that you can fix your allergies. And so, I was an allergy sufferer, and I realized that there had to be a better way to make it so that if you instead of just taking like Claritin, Zyrtec, Nasonex, Flonase for the rest of your life, what if you could actually just fix it? And immunotherapy is this really interesting way. And what we're trying to do is fix that access issue, right? There's just literally, you do the numbers, 80 million people, 4,000 allergists, it's just not going to work out. And we want to make it so that everyone can get the kind of care you get at, basically like an academic center from the convenience of home.
And in your eyes, talk us through, like virtual allergy care's role in the digital health space. And then, sorry to just like literally put my hand in the screen for those that are watching this. And then talk us through the future of digital health through your lens. Where do you see things heading?
Yeah. So I think that what we're seeing is that allergies and airway care and sleep apnea, all these things that have been done or let me restart. Basically, what we're seeing is that in digital health, I think my primary care colleagues have done a really, really good job, right? It's pretty easy to get virtual primary care now. You can go to One Medical, you can go to Astia, you can go to all these great people. I think mental health has been done really, really well. I think what hasn't been done well is specialty care. Now we're starting to see this with musculoskeletal care. We're starting to see reproductive care come by digital health. And what we wanted to do is really bring our specialty of airway, sleep, allergy, asthma into the 20th century. And so we're starting with allergies because, unfortunately, allergists tend to live in big cities, but people with allergies are everywhere. And so what we've seen with Wyndly is there's so much lack of access to specialty care in these rural areas in America. And then also, people are just busy, right? The traditional method of fixing your allergies was what we called allergy shots. It was this idea that you would come in that exposure that I talked about, where we expose your body to a small dose every week, had to happen in a physician's office. And so, when I was doing my medical training, I had this terrible allergy to cats. My wife, of course, loves cats and she loves them more than me. And so, my option was to go see one of my colleagues every week, sit in his office for 30 minutes, get a shot in the arm for 5 years. And when you're doing your surgical training, you just don't have that kind of time. And so thankfully, I was at a large academic university where I was exposed to this idea of what's called sublingual immunotherapy, this concept that you can do that same care, take those same medications, but under your tongue. And over time, your body gets desensitized in the same way. And so for me, this is like a life changing treatment, right? It saved me time. I didn't have to get a needle in my arm. And now I can go hang out with my friends with cats and not have to like think about, not being able to breathe or, see. And so I wanted to bring that to my patients. What sort of happened with Wyndly is it kind of happened organically, right? We were doing this in our physical office, the pandemic hit, and suddenly everyone didn't want to come to the office. So we started doing this care, basically virtually. And in Denver, people were driving from Vail, Aspen, up in the mountains all the way to come down and see us. When we started working with our patients locally using digital health, they loved it. They loved the time we were saving them. They loved the convenience, and they loved this idea that they could come see us, in a digital manner. But that if they needed something, they would come see us in our physical office. And so I believe the future of care is that hybrid. It's being able to give people that access, but also give them the opportunity to go see a physical office, when needed. And so right now, Wyndly is mostly digital, but of course, we want to build a hybrid program, because I think using technology and innovation in every way to get patient care better is ultimately the future.
Well, and speaking of that, what's next for Wyndly that you're really excited about that you can
Yeah,
share?
yeah, sure. I think one of the things we are certainly excited about is starting to build out that hybrid platform, right? I think one of the things that happens with digital health is people think it's this or that. But what I think is digital health is a tool, right? Healthcare is what we're trying to improve upon, and digital health is just one of the means that we're going to do it. We've been partnering with physicians around the country to start bringing kind of this type of Wyndly care to physical offices. And that way, patients can have access in whatever manner makes sense to them.
Well, I'm really excited to see how Wyndly continues to grow and hopefully have you come back on in the near future to give us an update on where things are at. But really appreciate you coming on the podcast here today, share your story, give us an allergy care education, and wish you and the team all the best of luck. Can't wait to continue to follow your story.
That's awesome, Jared. We really appreciate you guys taking the time to connect with us.